The ethmoid bone, or os ethmoidale, is intercalated or interposed between the orbital cavities and the nasal cavity, creating parts of their walls. From anterior, its visibility is very limited, and we can see the bone through the inside the nasal cavity partially, and visibility is limited to its lateral surface in the orbit. That is why I am going to expose it from behind after removing from here the sphenoidal bone completely, and thus we can see the three parts of the ethmoid, which are the lamina perpendicularis, or the vertical plate, which partially is in the nasal cavity and partially is in the neurocranium. The inferior part is bigger and creates the superior part of the nasal septum, and the superior part is smaller, and it's like a protrusion that is in the neurocranium and is called crista galli. The other component is the horizontal plate, lamina horizontalis, also called lamina cribrosa, because there are a lot of small openings piercing through it as they pass into the upper part of the nasal cavity, passing or containing the olfactory nerve fibers. And then the third component is the symmetrical labyrinthus ethmoidalis, which practically hangs at the two ends, lateral ends of the horizontal plate. And it is interposed, or they are interposed, between the orbit and the nasal cavity, and thus they have a nasal surface and an orbital surface right there. The nasal surface has multiple features, of which we can maybe see here the concha nasalis superior and concha nasalis media, the two turbinates that belong to the ethmoidal bone. While on the lateral surface, we have a good visibility. This is called the orbital surface. We have good visibility of lamina orbitalis, the orbital plate of the ethmoidal bone, which is also called lamina papyracea because it's very thin and broken off in many skulls that have been looked at a lot. So theoretically or practically, we have three components: the lamina verticalis, the lamina horizontalis, and the symmetrically placed labyrinthus ethmoidalis. On an isolated specimen, the ethmoidal bone, or os ethmoidale, this is its superior view, its posterior view, and its lateral or orbital surface view. Now, for reference, this is the skull, and this is where the ethmoidal area of the endobase is. So not much is visible from the ethmoidal bone. On an articulated skull, we have the three components: the vertical plate, lamina perpendicularis, with the two parts. We have the inferiorly lying nasal septal part, which is practically part of the anterior nasal septum, bony nasal septum, and we have the crista galli that protrudes into the skull and creates an attachment surface for the dural structure we call falx cerebri. Also, crista galli has two wings that, in fact, between them have the foramen caecum. These wings are called ale crista galli or ala crista galli here. Now, the horizontal plate is, as we expected, is very much pierced by many openings, which we call the foramina cribrosa. They are communicating with the nasal cavity right there, and this is why the name of the plate is lamina cribrosa. And the two lateral parts are also called labyrinthus ethmoidalis, and they have a nasal surface right there, and they have an orbital surface right there. The orbital surface creates the medial wall of the orbit partially. It's very thin, so it's called lamina orbitalis or lamina papyracea, papyrus-like. Then on the nasal surface, we have the concha nasalis superior, underneath which we have a tunnel, which we call a half tunnel, meatus nasi superior, and also we have inferior to that the concha nasalis media with another half tunnel, which we call meatus nasi medius. The anterior part of meatus nasi medius, as you can see here, narrows down into the so-called infundibulum ethmoidale. On an articulated skull, the ethmoid bone, most of it is hidden. What's visible is the orbital plate, lamina orbitalis, of the labyrinthus ethmoidalis. This is also called lamina papyracea because it's so thin. Then from anterior, from within the nasal cavity, we can see the lamina perpendicularis, or the vertical plate, as part of the nasal septum. We can see the inside of labyrinthus ethmoidalis in the nasal cavity, whatever is left of it. From the back, we can see maybe concha nasalis media up here, concha nasalis media right there. And obviously from the endobase, we will be able to pinpoint the crista galli with ala crista galli, the wings of the crista galli, that between them there is foramen caecum, and also the lamina cribrosa with the small openings we call foramina cribrosa.